I wanted to ask you, I keep when I'm going through these questions, I still do eliminate first. It's like I'm trying to change that habit to
Sure.
like gut reaction first.
Sure.
So is that something I should be like looking out for, like I am, or is it
Yeah, I would say
okay?
that when you're going through questions, the best idea, I mean, the train of logic, I can already tell that you've gotten better.
Okay.
But how was I going to say this? Ideally, right? Ideally,
Hmm.
you want to kind of like imagine in a sense, right? Like for instance, this is a most likely diagnosis. So in your mind, I mean, it's a diagnosis question. So you want to kind of pull that answer choice from your head first. So aka a
Okay.
gut answer choice first, because sometimes when you eliminate stuff, it's like um,
Well, what
it's
I
a
noticed
very
in the question banks is I'll eliminate it first, and that'll be the right answer.
yeah,
And I'm like, why
exactly.
does this keep? I'm like, why does this keep happening? I know it happened like a few times the other day, and I'm like, this keeps happening. It's kind of weird.
Yeah. So I would say,
Okay.
try your best to kind of pull it out of your own head first before you kind of
Okay.
eliminate, because sometimes, like you said, you're kind of in a sense working backwards a little bit. And so that can
Yes.
you can accidentally cross out the right answer because you're like, oh, that can't be it, because you're trying to reason it backwards. So that's why I
Okay.
always try to get my students to, before to start eliminating, try to kind of come up with an answer off the top of your head first and then kind of go from there.
Okay. All right. So let's see. Which of the following is most likely diagnosis? So diagnosis question. Look at the answers real quick. Looks like more like headache, neuro world. So 35-year-old woman presents to clinic 1 week history of worsening headaches, blurred vision, occasional nausea. She has no significant past medical history. Physical exam, her blood pressure is 125 over 80, pulse 78, BMI is 32. Fundoscopic examination reveals bilateral optic disc swelling. Brain MRI is normal, which is the following. Okay. The bilateral optic disc swelling is definitely like a hot word. Um, does she have, okay, she does have blurred vision. She does have headaches. How long has it been going on? 1 week. So, hmm, I like intracranial hypertension, but I'm not sure.
Okay, so that's a gut. I like it. So you started with the
Yeah, that's sort
good.
of a gut. And now let me go backwards and see. Like migraine, I definitely don't like, so I definitely wouldn't pick migraine. Optic neuritis, I'm pretty sure is one eye. Central venous sinus thrombosis. If I remember, that's more of like I don't know if this is right though. Cranial nerve six. Something is telling me that in the sinus. It's more like an anatomical, but I'm not sure. Brain tumor, I think, is always possible, but the MRI was normal, so I'd get rid of that. So really down to those two, and I would. My gut was thinking the hypertension, although her blood pressure is normal. Nausea, worsening headaches, blurred vision. I'm just thinking that pressure is going to press down on that cranial nerve too, and sort of give her the blurred vision. But I'm not. Okay, I think I would go with it, but I'm not super confident with this.
Good. I love the way you work through this. Okay.
Okay,
Beautiful.
okay,
Okay. This is how I want you, because you have to, when you get down to these two, people end up choosing the wrong one because they switch the answer. But
right.
just remember what I told you kind of a long time ago. Do not switch your answer choice unless you're 100% sure. So if you're like, oh,
Okay,
I kind of remember, but don't, that's not a good reason, right? You got to be like,
okay,
oh, I'm changing it because of this, right? A very, very
okay,
strong reason. So this is
okay,
great. And and don't worry about being unsure. It's okay to be unsure when you're doing questions, because that's kind of like your clinical brain going, okay, I'm leaning more towards this, so I'm kind of putting that answer choice, and that's okay. So let's work
okay,
through this kind of. I'm gonna clear it up a little bit so you can kind of see. So
okay.
obviously, most likely diagnosis. It's a diagnostic question. Reading through this, it's a kind of a neurology question. So
Mm-hmm.
35-year-old woman, it's a younger woman here, clinic setting, so it's not an acute setting, right?
Mm-hmm.
1 week history of worsening headaches, blurred visions, occasional nausea. So it's like, not super acute, like I said, right?
Mm-hmm.
Not super chronic either. It's kind of that time frame in the middle. No significant past medical history, so she's relatively healthy. Blood pressure is normal. Pulse is normal. And then remember, I want you to think. Anytime they give you something, you have to ask yourself why they give it to you. So her BMI is 32. So she's overweight, right?
Okay.
So, fundoscopic exam reveals bilateral optic disc swelling. So you know that there's increased pressure in her brain, right, or kind of
Hmm.
her skull to kind of cause her optic disc to swell. And then brain MRI is normal, so you know there's no masses, tumors, anything like that.
Right.
So migraines, right, is not going to give you optic disc swelling. Optic neuritis, right, that's usually with multiple sclerosis, right, and so you can see some
Hmm.
of those lesions in the brain. Usually it's really, really painful on one eye, usually to move it around. Cerebral venous sinus thrombosis, kind of like you said. This is more of a sinus issue. It's a really, really bad sinus infection that can go in. That's like they call it Chandler classification. You don't have to know that. That's a very ENT thing, but that's
Okay.
the worst Chandler classification. If it gets into the cavernous sinus, right? Or it's cavernous sinus thrombosis actually, but this is cerebral sinus venous sinus thrombosis. But that's a really, really
I
bad
think I was
infection.
thinking cavernous sinus, right? I think
Yeah, cavernous
that's probably
sinus.
what
I
threw
also
you. Okay.
misread it as cavernous sinus, just to
Okay.
know. But yeah, that's not gonna, like having a thrombosis, either one, a really bad infection, or you make a lot of clots, which doesn't really make sense here. That's gonna be a very acute issue, right?
Okay.
Brain tumor, like you said, the MRI doesn't show it. So best answer here is idiopathic intracranial hypertension. And just in case they test you, this used to be called, or still called, but not as much, pseudotumor cerebri.
Okay. I've
Okay.
heard of that. Okay. Okay. And then the BMI has something to do with that. That I didn't
Yeah,
know
it's a
that.
risk factor. So
Okay.
usually it's females that are overweight have
Okay.
an increased risk for pseudotumor cerebri, or aka idiopathic intracranial hypertension.
Okay.
Okay.
Awesome.